Good day, ma'am. I'm Olive Grace, your physical therapist for today. Ma'am, can I get your name and age?
My name is Julie 16 years old.
Okay. So for today's session, ma'am, before I proceed to my to our activity, I would like to get your vital signs first. Is it okay? Okay. So assuming that I have already got my patient's vital sign, and then they're all within normal limits. Okay. So, ma'am, I've seen in your record that you have a labral tear in your left hip. Is that true? Okay. So, ma'am, when's your scheduled surgery the eye?
Next week.
Okay, next week. So for today's session, ma'am, I'll be training you with some bed mobilities or how you transfer from your bed to your chair so that we could at least lessen your mga bed sores like that. Okay? So, ma'am, can you lie in your back? Let's try to not move your left leg since this is the affected leg, man. Okay. Sige, I'll try to raise your affected leg, ma'am. Sige. And then try to move your kanang leg dito sa bed. Sige. 1, 2, 3, go. Okay. So, for this, ma'am, I want you to move a little bit sa middle sa bed. Okay. Okay. So, with your condition, ma'am, you have to avoid 90 degrees hip flexion as well as excessive internal rotation, or when you try to bring your knees inwards, and then you can also jump or rotate your hips, okay? First, ma'am, I'm gonna teach you how to position yourself from a supine or yung nakahiga with your back towards side-lying position, okay? So, ma'am, can you try to move a little bit? Wag mong i-rest yung ulo mo sa bed, sa pillows. Okay. Okay. A little more, ma'am. Okay. So, for this, I want you to tuck in your left. Yes, your left arm, and then try to cross your arm dito, your right arm. Okay. So, in mobilizing towards sideline position, I want you to cross your legs din dito, and then try to move. Can you do it yourself, ma'am? Okay. So, if you can't do it, you can tell me so that I could help you in moving towards sideline position, okay? So, again. Go back to the supine position. Then, if you can't do it, I can help you by supporting the racing shoulders and then your hips. Okay? Can you try to press your... Okay. So, the next thing I'm gonna teach you is when you try from that position to a sitting position sa iyong bed. Okay? So, for this, you will be dangling your legs. Idangle mo yung legs mo sa bed. Yan. Huwag mo masyadong i-flex yung hips mo, ma'am, ha? Little flexion lang. Little bending lang sa hips mo. Tapos, you can help yourself, you can push this arm para makabangon ka, okay? Sige, can you do it, ma'am? 1, 2, 3, go. Okay, very good. So next is when you try to get up, okay? So, I want you to move, since you can move from sa edge of bed, since you can fully flex your hip, man. So, decrease lang tayo sa mama? I-extend mo lang yung legs mo. So, your left leg is affected. So, in standing, example, this is your walker. When you stand, always remember that you can flex your hip into 90 degrees flexion. So, when you stand, I want you to hold the same walker, and then I'll support you in standing without flexing your trunk or yung yung event mo, yung upper body mo. Huwag mong event, ma'am, ha, upper body mo. Okay. So, I want you to stand up in 3, 2, 1, go. Okay, very good. Can you go back from sitting naman? I-forward mo konti yung affected leg mo, a little more, and then try to reach sa bed. Just down. Huwag mong i-bend yung, okay, that's good. So, before your surgery, ma'am, I want you to practice those things na I told you kanina, like from your supine to side lying, from side lying to sitting down to your bed, to at least avoid body contractures of your muscles, like that, yung para may para makapag-function pa rin yung body mo, okay? Okay, so that's it for our session. See you next week sa post-op management mo na, ma'am. Okay? Thank you.
Good evening, sir. My name is Christian Acetabular. I'll be your physical therapist for tonight. May I confirm your name, sir? Okay, so ikaw to, sir, kung nagka-hip labral tear? Okay, so I will be in charge for the post-operative management of you, sir. So, silbi ako yung handle mo for the next 2 weeks or 14 days. Alright, is that okay with you, sir? Okay, so, atong buhaton, sir, kay ang mga exercise na kani kay pangpawa, reduce lang ni siya of pain or swelling, and then to also manage your range of motion sa imong hip. So ato, it's important to know na dapat dili nato ilapang 90 degrees, 80 to 90 degrees of flexion ang ato ang hip. Dili dapat nato ipataas maayo. Okay? So ato pong ilimit atong external rotation, and ang atong abduction. Alright? So also, kanang important siya para dili ta magka-develop of contractures, wala mag-range of motion exercises ta. Specifically, isometric exercises or kanang dili ma-change ang length ng muscle. Okay? That's okay with you, sir? Okay. So, ang first nato intervention, sir, is active assistive range of motion para sa imong abduction and adduction. So, kani siya, sir, ako rin siyang buhaton in a pain-free motion. So, tingnan ko if nagsakit ang imuhang hip if I do the actions, okay? I will divert to another treatment, okay? So, I will start, sir, ha? I will adapt. Sakit. Nabangi ko ang action, sir, kaya active assistive niya siya. Help me. Okay? Sige, sir. Okay. Okay. May pain? Wala. Okay. Alright. Okay. So, ang next na itong button, sir, kaya nato ang exercise number 2, which is the glute set. Kani siya, imong i-squeeze, imong lubot, imong ipatapok silang duha. Okay? I-try imong ipatapok. Okay, ako lang tawag sa'yo, if nagtapok siya, sir, ha? Buhatan na siya, sir. Okay, 1. For 10 seconds, and then 10 repetitions. Okay, down. Rest. Rest not dito for seconds. And then, sige, balik na mo gota. Okay. Okay, very good. Okay, assuming na naumana na ito ang 10 repetitions and 10 sets, proceed ta sa atang bilateral ankle pumps. So, kani siya, sir, ang imong tiil, imong i-pump, like, tuyod nimo, ayaw, i-tuan, up, down, imo i-up, down, yung tail, okay? Sige, ang duha ka buhok. Okay, sige, go up. Kaning tibok tail yun, ang i-up. Up. Okay, kana, good. Down, up, down, up, down, up, down, up, down, up, down. Okay, for 10 repetitions po siya in 3 sets, okay? So, wala na kayo debate sa itong mga exercises so far?
Wala.
Okay, wala na. Next is, ito ang isometric exercise yapon sa imuhang kaning sa inyong knee. So, kani siya, dili mo change ang length sa imong muscle sa imong quadriceps, okay? Akong ibutang dire, under sa imong tiil. Okay, dire sa imong knee. Under sa knee, right? Alright. Now, what I want you to do is to press on the kaning panakton nato dire. Ato i-push down gamit ang atong knee. So, mura siya ga extend, okay? Sige, buhaton nato na 10 times for 10 seconds. Okay, 1, 2, 3, go. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, rest. And then, up na po. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, so wala na kayo debate ang tracer? Okay, wala na. Ang next exercise na po na to, sir, kaya ang atong heel slides. So, atong buhaton ani, kaya atong heel, atong i-slide up. It is important to know na dito siya mulapaw o 90 degrees ang atong deflection. Then slide down. Okay, slide up, slide down. Slide up, slide down. Okay, muna siya kung instructions ni sir. Okay, try daw taong slide up, sir. Minimum. ka na. Go. Down. Slide up. Slide down. Slide up. Slide down. Slide up. Slide down. Slide up. Slide down. Okay. So, ang next na po nato na exercise is glute bridges. So, kani siya, dili nato ni kuan if sakit yapon siya, okay? Inara ko, yes, may sakit sa imong affected side. Okay, so dapat dili 90 degrees. Okay na. Okay, I want you to lift your butt, sir. Lift. Okay, down. Lift. Down. Okay, just that. Lift. Down. Lift. Down. Wala sa atong glute bridges. Okay? Wala na kayo libati ato, sir. Okay. Go. So the next exercise, sir, will be the stationary bike cycling. So kani siya ang bike kay naaragid siya sa usa ka place, and then you will try to pump it with your legs para ma-promote ang imong range of motion sa imong legs. But the video that I will show you is just me doing bike cycling because my patient was not there, and then disclaimer lang na nakaabot to siya og 90 degrees deflection because it was not intended for our height. It was intended for smaller people. So nakaabot siya og 90 degrees akong pagbike ato. But of course, naagyo tayo na dili maabot og 90 degrees of hip flexion ang atong pagbike, okay? So, to progress sa ato ang phase 2 or sa weeks 2 above will be kuan by my classmate. In order to progress to that, there is dapat minimal na atong pain sa 90 degrees hip flexion. So dapat minimal ra ang pain, and then of course maka-partial weight bearing ka. Pero up to 10% lang, mura atong precaution, 10% lang sa imong weight. And then of course, if the doctor said so, na pwede na ta maka-progress into that phase, okay? Of course, if gabay na lang ang limitation sa atong hip external rotation, atong abduction and extension, okay? So dapat gabay na atong limit nila, dapat padulong na siya sa itong side motion. Alright, so assuming na umana na kami sa among treatment na mo karong gabi una, I will now assure my patient's vital signs after every treatment. So if it's within normal limit, I will note that within normal limits sa atong tickler, and then of course ask the patient for feedbacks if na ba siya diganahan sa atong treatment, or he has any concerns about the treatment. Okay, so sir, naara tay problema sa atong treatment. Okay, my patient said wala lang or wala. So you are now good to rest, sir. Okay, thank you sir sa imong time, and then hope you recover really soon. Okay.
Good day, ma'am. My name is Princess Ma'am, and I'm your physical therapist for today. So, may I know your age? I mean, name, age, and address, ma'am.
My name is Billy May Benota. I'm 17 years old from high school.
Okay, so assuming that I'm done taking your vital signs are all are in normal values, and I'll proceed to the rehabilitation. So, since we are now in the controlled motion phase, on our day 12, we will be doing full ROM and standing exercises. So, is that okay with you, ma'am? Okay, so for our goals for this one is to improve your flexibility and hip mobility, as well as control pain and then promote healing. Okay? Yes, I want you to lie down here, and I'll be assisting you. Okay? Go. So for full ROM, lift your affected leg to your chest. Okay? Go. Okay, very good. So let's do that 5 repetitions. Okay? So 1, 2, 3, 4, 5. Okay, very good. And the next is we'll do the abduction. So for that, I'll lift this leg and then put this leg here and then do inward. Okay, to inward. Okay, so let's do the 5 repetitions. Okay, I want you to do it first. Okay, very good. So let's do it again. 1, 2, 3, 4, 5. Okay, very good. And then next is I want you to do abduction, which is put your affected leg outward. Okay? Yeah, let's do it. Okay. So yeah, go. 2, 3, 4, 5. Okay. And the next is internal rotation and external rotation. So I want you to flex your uh, leg, and then okay, stay in that position, hold up, and then um, put this inward. Okay, very good. Okay, so let's do that 5 repetitions. Okay, 1, 2, 3, 4, 5, and then do it outward. Okay, 1, 2, 3, 4, 5. Okay, very good. And then the last one will be extended position. Yeah. Okay, so I want you to lie in your stomach. So I'll be assisting you lang. Ha? Yeah, so I want you to move there first. So bend your knees, and then lift your butt, and then use your elbows to scoot there. Okay, very good. Okay. So we will do a side lying position, and then we're going to do a front position. Okay. So can you do a side lying position? And then front. Okay, very good. And then I want you to extend your hips. Your knee, this one. No, do that. Okay, so 1, 2, 3, 4, 5. Okay, that is for hip extension. So I want you to go back to the front. Can you scoot here? So same. Here, okay. Okay, so we will not doing standing exercises. So for standing exercises, I want you to do this for support, and then first thing we will do is hip flexion. So you can just do that, and then we will do it for 5 repetitions. Okay. Okay, I want you to count 1, 2, 3, 4, 5, and then knee extension. I am in hip extension, so can you move here? Okay, and then extend your hips like this. Extend, yeah, like that. Okay, so for 5 repetitions, 1, 2, 3, 4, 5, and then abduction. So put your hips upward like this. Okay, then 1, 2, 3, 4, 5. Then we'll do forward marches rather. So like this, march. So we'll do that 5. Okay, 5 repetitions. 1, 2, 3, 4, 5. Then we will do calf raises. Okay, so same, we get support here, and then do this. Tiptoe. Calf raises. Yeah, okay. So we'll do that 5 repetitions. Okay, 1, 2, 3, 4, 5. Okay, and then the last one is mini squat. So yeah, then you can widen your basic support. Okay, and then do mini squat like this. Okay, I want you to do it 5 repetitions. 1, 2, 3, 4, 5. Okay, so I think that is all. Do you have any questions?
No.
Okay, so I will be getting your vital signs, then assure you again that it is all in normal values. Then I can now leave you outside the clinic. Okay, so thank you, mom,
Thank
and
you.
see you again next rehabilitation.
Assuming that I've already done hand hygiene before putting on my PPE, and also that I'm wearing my face shield right now, so I will now start. So, hello sir, I am Royna, your physical therapist for this morning. May I get your name and your birth date?
My name is Rockland Ramirez.
Okay, so I will just confirm sir that you are my patient who has recently done a labral repair or acetabular labral repair about 3 weeks ago. Okay, so meaning sir, the week before or my colleague already started strengthening and balance exercises, standing exercises with you, sir. Is that correct?
Yes.
Okay, so right now, sir, we will be doing some pelvic stabilization exercises and some dynamic balance exercises. So the purpose of these exercises, sir, is for the pelvic stabilization, we need to strengthen the muscles surrounding surrounding the joint in order to provide stabilization. So strong muscles, stabilize na stable imong pelvis. Okay, strong, stable imong joint. Okay, so the other one, sir, for the dynamic balance exercises, the purpose for that one, sir, is in order to not only increase your balance, but also to slowly get you up and moving, and then slowly integrating some functional movements and exercises in your daily life, your post-op, okay, post-op rehab. Okay, so now, sir, assuming that I have already done your vital signs and it is all normal, I will now proceed to the treatment or the exercise. So for this one, sir, we will start with the pelvic stabilization exercise, specifically the glute bridge. So for the glute bridge, sir, I want you to have your feet, your heels, okay, ana. Okay, ayun lang kayo i-flex imong sir, so that you don't go beyond the 90-degree hip flexion. Okay, sir, so sakto lang. Your feet should be shoulder width apart, so a little bit apart, sir. Your feet, no, sakto lang, sir. Just a little bit away from each other. Okay, that one, sir, is that comfortable? Okay, so for this exercise, sir, what I want you to do is you will bring your butt, you bring it upwards, and then up. I'm still giving you instructions, sir. Okay, so I will give instructions, and then you will do it while I guide you, and then you will do it alone. Okay, so that will be okay, sir. Okay, so first, bring your bottom up. So you need to do it in a slow and controlled manner. You know you're doing it in a slow and controlled manner if you can feel that you are going one segment at a time with your spine. Okay, so going up one segment at a time, then going down one segment at a time. Okay, and then as you go up, sir, you could also move your knee forward in order to because that would cause the mas stable imong pelvis, sir, gamit sa imong muscles, ana, sir. Okay, sir, and then as you go up, sir, don't arch your back. Okay, don't arch your back. Nasakto lang because so let's try to do it 2 times, sir, na mag-help ko nimo. Okay. Okay, ready na, sir? Okay, so if you feel any pain or discomfort throughout the procedure, sir, tell me. Okay, sir? Okay, go. Down. Up. Down. Okay, so maybe we could move that down, sir. Okay, do not over-arch your back, okay, sir? Try to squeeze your muscle so that makuha nyo yung mga contact siya. Okay, let's go. Let's do it 5 times, sir. Okay, sir? Go. Move up. And down. Up. Down. There's 3, 4. Down. So for the 5, sir, let's hold it for 3 seconds at the top, okay? And 5. 1, 2, 3. Okay. Very good, sir. Now for the next one, sir, I will want you to be in a side-lying position. The next one would be your clamshells. So for the sideline position, sir, okay, sir, I will teach you the proper transfer. So with your left hand, you will with your left hand reach to the side and then just roll your body. Okay, sir, don't worry, sir, I will help you. Okay, go. Okay. So for the clamshell, sir, okay, sakto na, sir. I want your body, your legs to be on top of each other. So for this one, sir, I want your knee, this is the operated leg, diba? Okay, I want your knee to go up. So, marasya, sir. Okay, sir? But make sure that your feet will not separate with each other. So, you're not going, pagawas ni mo when you're rotating, like, move up siya. No, that's wrong. Okay, sir? It needs to stay on, Then, make sure that your pelvis will stay straight, perpendicular to the floor. Dili siya in a way nga. Mura siya, as you're going up, you're like this. No, this is wrong. Do not twist your body, okay, sir? Stay lang siya, stable. Okay, let's start it, sir. Let's do 2 reps with my supervision. With my answer. Okay, go. Okay, 1. Second. Okay, I think you got it, sir. Now, let's do the 5 reps, okay, sir? Yeah, again, if you feel any discomfort or pain, tell me, okay, sir? Okay, go. 1, 2, 3, 4, and then 5. Okay, how is that, sir? Are you feeling okay? You're not yet tired? Okay, so next, sir, what will we be doing? Remove. Okay, next sir, what we will be doing is we will be doing some hip lying abduction. So you're now in the position, but I just want you to straighten this leg. Kanina sa top leg, sir. Straighten ang top leg. Then the bottom leg will be there for support. Okay? So now, sir, it's kind of similar to your clamshells. But this time, your leg is straight. I want you to bring it back up. So a little bit behind. Okay, sir, a little bit behind. Up. Bring the left leg up and a little bit behind. Emong heel dapat na maguna, sir. Okay? And then, keep your pelvis straight and stabilized, perpendicular to the floor. Okay, sir? Do not twist it. Okay, very good. Okay, let's do it twice. Twice, okay? Go. Okay. Stabilize your pelvis. Okay, keep this straight. Down, okay. Relax na, sir, relax. Keep this straight, straight. Okay, like that. Okay. Okay, let's do it 5 times, sir, okay? Go. Okay, very good. That's 1, 2, 3, up, very good. Straight, keep it straight. 4, very good. And then 5, last. Okay, very good. For the last exercise for our pelvic stabilization exercise, sir, we will do your side plank. So for that, sir, I want you to prop your body on your elbow. Okay, I will help you, sir, don't worry. Okay, prop it. Okay, very good. Okay, make sure that your elbow is directly aligned to your shoulder so that will not cause any shoulder pain or any shoulder problems. For this one, sir, you could keep your knee a little bit bent. Okay, then this one, sir, I just want you to bring your body upward. And up. Okay, that's good. Okay, make sure that you're not overarching as you go up and you're not sagging as you go down. So for that, you need to squeeze your muscles. Okay, sir, you squeeze your muscles and so that tarong imuhang pag-execute. Okay, sir? So, okay, keep your body straight. Okay, that's good. Sige, sir, let's start, sir. So, let's do it 3 times with 5-second hold at the top. Okay? Sige, go. First. Okay, up. 1, 2, 3, down. Okay, up. 1, 2, 3, down. Last up. 1, 2, 3, down. Okay, very good. So, we're now done, sir, with our okay, prop down, sir. Okay, go. So that was our pelvic stabilization exercises, sir. Again, the purpose of that is to strengthen the muscles surrounding your joint, specifically your glute muscles, your gluteus maximus, medius, and your glute minimus. So, muna sila ang mga naigo mga muscles kanina, sir. And then, if you strengthen those muscles, you will provide stability to your joints. Okay, sir, we will now proceed with our dynamic balance exercises. So for this one, sir, the purpose of this is, once again, as I said earlier, this is to increase your balance, improve your balance, and at the same time to slowly integrate, get you moving, slowly get you moving up, slowly integrate functional movements like walking, etc. So first, what we will be doing is, first is sideways walking. So there are rails here, you can hold on to the rails, and then just step sideways. Let's do this on 5 steps. Padintuan, 5 steps pabalik, okay? 1, 2, 3, 4, 5, and then back. Okay? And then the next one is forward marching and retro walking. So once again, you can hold on to the rails. So 1, 2, 3, 4, 5, and then backwards, retro walking, 5 steps also. So I want you to remember, sir, that we're still 3 weeks. So protocol states that you need to be in partial weight bearing up until 4 weeks. So 3rd week komenta, sir. So remember, since you have reels here, so don't bear so much weight on this one. So just imagine like you are stepping on an egg. So ayaw kayo siya i-quantum pressure, okay? But also don't tiptoe because that's an abnormal gait. Okay, now I will be placing your weight belt around you, sir. Okay, very good. Enough? Fine, sir. Okay, so, okay, we can hold up the rail, sir. Now, let's start with our sideways walking. Okay. 1, 2, 3, 4, 5. Okay. Now, we have started that with your non-operated leg, okay? So, ang karoon na po, mag-lead na po, sir, is your operated leg. Just slowly, sir, remember, partial weight bearing on this leg. Okay, go. 2, 3, 4, 5. Okay, next, sir, we will have our forward marching. Again, sir, forward marching. Do not go beyond 90, sir. Ayaw kayo, yan, nagmaayaw. Tana lang, okay ni siya. Okay? Again. Yes, sir. Holding your seatbelt, and don't worry, I'm guarding you, okay? Let's start with, okay, let your unoperated leg lead. So, ngayon lang crutches, ha? 2, 4, 5, okay? Then backwards. 1, 2, 3, 4, 5. Okay, now I will let you sit down, sir. So, sir, did you feel any pain or discomfort during the exercises? Any fatigue? Okay, now I will now do once again your vital signs, sir. And assuming that I have done your vital signs, do you have any questions, clarifications, pain and discomfort, or okay, sir, since everything is good, I will now be going. Thank you so much. Thank you so much for operating. I will see you next week. Okay, thank you, sir. And then afterwards, I will be doing my hand hygiene and then proper disposal of my PPE. And then I will be going.
Good day, ma'am. I'm Olive Grace, your physical therapist for today. Can I get your name and age, ma'am?
I'm Kenneth Olive, and I'm 16 years old.
Oh, okay. So you were my patient before yung nag-pre-op management tayo because you'll be having your surgery for your labral tear. Am I right, ma'am? Okay. So now we're down to our last few sessions for your for physical therapy. Okay. So before we proceed to our activity today, ma'am, I'll get first your vital signs. Is that okay? Okay. So assuming that I have already get my vital signs of my patient and they're all within normal limits. Okay, so for this session, ma'am, we're going to start, or this is now your return to function phase. Yung pwede ka na maka-do ng mga full range of motion sa affected leg mo. Dahil this is already our purpose for this session is like to strengthen already your hips. We could improve your muscle strength and endurance as well as your capability to do functional activities. Okay, so we're gonna do maybe 3 to 5 exercises today. Is that fine? Okay. For our first exercise, ma'am, I want you to do flexion of your hips like that without bending your knees, abduction, extension, and as well as adduction with the resistance I will going to apply later. Okay. Since we don't have the resistance band that we can wrap around your legs, I will be using this one. This is still stretchable. And while you try to move or you try to flex your legs, I will be using this to apply the resistance. So you will be doing this for 15 repetitions, 15 times, ma'am, ha? Both your left and right legs. Is that fine? Okay, so I will now put this in your leg dito sa baba. So, ma'am, can you try to bring your leg forward or try to bend your hips lang, ma'am? Practice. Sige pa. Okay. So, you will be doing this for 15 times, ma'am, ha? Sige. 1. Are you ready? Okay. Sige. 1, 2, wait. When you perform this, please tell me if you feel any discomfort or pain during the exercise, ma'am, ha? Sige. Can you start now? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, so assuming that she has already done it to her opposite leg, okay. So now we'll proceed to extension, okay? You extend your legs, I want you to bring it backwards, just like this, okay? Okay. You can do this for 15 times again, okay? Sige, 1, 2, 3, go. 1. Don't bend your knees, ma'am, okay? Sige, 1, 2, 3, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Do you feel any pain, ma'am? Okay. 12, 13, 14, 15. Okay, so that's it for our extension. Next is the hip abduction. So I want you to bring your legs sidewards like this. Sidewards lang. Still with resistance. I will be putting the band here and then try to bring it sideward. Wait lang. Are you ready? Sige, 1, 2, 3, go. 1. Move it. Sige, Jud, ma'am. Counteract. Sige, na, like that. 2, 3, go. 4. I don't try to do, don't bring your knees outward. Just kanang inani lang good. Nga position neutral lang. Sige, 1, 2, 3, go. 4, 5. Sige, ma'am. 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, so how do you feel, ma'am, sa imong legs? Does it hurt na? Or can you feel the muscles working? Okay, so next is the adduction. This will be the last for this exercise. I want you to bring it inwards like this. Still with resistance. I will be applying resistance. Is it okay? Okay. Okay, I want you to bring your leg to inward or papunta doon sa left mo. Okay? Okay, 1, 2, 3, go. 1. Sideways lang, ma'am. Sideways. Like this lang, ma'am. Okay. Sige, 1. Are you ready? Sige, 1, 2, 3, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, that's it. That's already enough for this exercise. So, wala bang masakit, ma'am? Wala kang nararamdaman na sakit?
No.
Okay, so for our next exercise, I want you to do the reverse lunges. For this, ma'am, it could help strengthen your hips as well as your muscles, okay? So for these reverse lunges, ma'am, it will be just bending both your hips and knees, but you need to bring your right leg forward. And then, if you can't, if medyo hindi ka pa sure sa pag-balance mo, you can always have a chair or anything na stable so that you could be for your assistance. Okay? You can hold here, ma'am, if medyo hindi ka pa sure sa pag-balance mo. Okay? Sige. So, don't bring your knees, don't let your knees touch the floor. Okay? Just, maybe a little distance lang from the floor sa ang knees mo. Okay? You can hold here sa table, sa chair. And then, are you ready? Sige. Bring your right foot forward. Sige. 1. 15 times. 2. 3. 4. 5. 6. 7. 8. 9. 10. 11. 12. 13. 14. 15. Okay, that's it. That's very good. So, how do you feel sa hips mo, ma'am? Does it hurt? Meron ka bang nararamdaman na sakit? Wala. Okay. Now, for our last exercise, ma'am, I want you to do the side lunges. Now, so it's the same with the reverse lunge, but this one will be doing it sideways. For this, ma'am, I want you to bend a little bit imong knees, a little lang, as well as your hips, a little flexion lang, and then move sidewards like this. 1. Yes, and then bring it back. See? So you'll be doing that for 15 times again, and then I will be applying resistance. Okay? Diyan sa left leg mo, left knee. Sige. This exercise is as to strengthen still your muscles and then your hip. Okay? Sige. Sige. Are you ready, ma'am? Sige, 1, 2, 3, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. Last. Okay. So that's it for our session today, ma'am. We will only have 3 exercises. Maybe we could progress your exercise same on next session. Is that fine? We could try stair climbing to improve your functional activities or the way you work or deal with your functional activities. We could try like mga harder exercises to improve your the strength and then your endurance of your hips. Is that fine? Okay. So how's your how do you feel today, ma'am, sa exercise? Okay. It's okay. Wala ka ba na feel na masakit or anything? Okay. So before I let you go home, ma'am, I will be taking your vital signs first to check if okay lang ba or wala bang changes. Okay. So assuming that I have already get my patient's vital signs and then they're all within normal limits, I could let my patient now go home. And then that's it for our session today, ma'am. Thank you. Do you have any questions? No. Okay, so that's it. Thank you so much, ma'am.